Genetic Counseling for Families with a History of Cancer. This presentation is about Natasha and her family's experience with breast and ovarian cancer. We hope that Natasha's story helps you learn why these cancers happen and how to stay cancer-free.
I'm Natasha, and I'd like to share my story with you. Breast and ovarian cancers have affected my family for many years. I want to share with you what I've learned about why some cancers run in families. First, I will tell you about my family's experience with cancer. This is a picture of my family. Some of the women you see here have been affected by breast or ovarian cancer. My cousin Sabrina, my mom Dolores, and my Aunt Gina have all been diagnosed with cancer at young ages. My cousin Sabrina was only 31 when she found out that she had breast cancer. Although a lot of our friends were shocked to find out that someone so young had cancer, I was upset but not surprised. I had seen this happen in our family before. I was 18 when my mother Dolores, who was then 45, was diagnosed with ovarian cancer. My Aunt Gina got breast cancer in her late 30s. This is a picture of my grandma, Wanda. I was told that she was in her 40s when she was diagnosed with cancer. I always knew that the women in my family were different when it came to cancer. We had more women in our family with cancer than other families I knew. I grew up in this blue house in a neighborhood in a big city, and the same families had been on my street for as long as I can remember. All these women circled in my family had cancer, but I knew many other families in my neighborhood, and none of them had as much cancer as ours. My friend Anna, who lived in the greenhouse across the street, told me her mom had cancer and her grandmother on her father's side. Anna's mom, Lucia, was 55 years old when she got breast cancer. This was much older than the women in my family. And her grandma, Sophia, got cancer when she was 75 years old. And both of us knew a neighbor down the street who only had a distant relative with cancer, but no one in his immediate family had cancer. Although all of our families were touched by cancer, my family seemed very different because so many more of my family members had developed cancer and at younger ages. My family and Anna's family had always been close and had been going to the same church since we were little girls. We'd all eaten similar foods and had similar jobs, so I often wondered why my family is different. It was at that time that my doctor suggested that I meet with a genetic counselor. The counselor's job is to try to figure out if the cancer was being passed down in my family from generation to generation. This is what the genetic counselor told me. Only a small amount of cancer runs in families, as shown in the red slice. This is called hereditary cancer. In these families, many relatives have cancer. Most cancer occurs by chance and does not run in families, as shown in the blue slice. These families have few relatives affected by cancer. In other families, there may be some family history of cancer due to a combination of hereditary and non-hereditary factors, as shown in the gray slice. In the general population, most women have little or no family history of cancer. If you are looking at 100 women with little or no family history of breast cancer, 10, colored in yellow, will get breast cancer sometime in their lives, often after age 50. Out of 100 women who have some family history of breast cancer, about 16 out of 100 will develop breast cancer in their lives. These women are at a slightly higher risk for developing cancer compared to women with little or no family history. The picture looks a lot different if you look at women who have a strong family history of cancer. As many as 80 out of 100 of these women will get breast cancer. In families with hereditary cancer, a higher chance of getting cancer is programmed into small particles in their bodies that scientists call genes. This picture shows what a gene may look like. You can think of a gene as a page in an instruction book that tells the body how to work. We cannot see our genes because they are inside our bodies. We have many organs inside our body. Our heart, our liver, and our lungs are all organs. If we looked with a magnifier at a very small part of any of our organs like our lungs, we would see lots of tiny structures called cells. If we looked with a magnifier at just one of these cells, we would see structures that are even smaller. These are the tiny building blocks that we call genes. There are many genes inside each cell, and there are 2 copies of every gene. You can think of 2 gene copies as 2 copies of the instructions for making us a person. We can find the same set of genes in every cell in our bodies, in the heart, the blood, and the breast, as well as everywhere else in the body. When we are born, all of the genes are present in every cell in our bodies, having been passed down from our parents. Each gene pair has a job, like making our eyes a certain color, or our hair straight or curly, or our nose a certain shape. We even have a gene pair that helps protect us from certain types of cancer. Together, all of these genes help our bodies grow and work properly. For each gene pair in our body, we get 1 copy from our dad and 1 copy from our mom. Sometimes our genes have genetic changes, also called mutations, that make it hard for our bodies to work properly. A genetic change or mutation is like a page in an instruction book that cannot be read. To show how the genetic change or mutation was being passed through my family, the genetic counselor showed me my family tree. Here are our grandparents, Wanda and Calvin. My grandparents had 4 children, Dolores, Darnell, Gina, and Alicia. And then their children had the children you see pictured here. Here is a picture of me and my sister Imani. After looking at our family tree, the genetic counselor suspected that a mutation was being passed down from generation to generation. This is a picture of Grandma Wanda's instruction book. The 2 pages of the instruction book represent 2 copies of a gene. One of the pages in her instruction book has the correct information, and the other has a change and cannot be read correctly. This change in one of the pages increased Grandma's risk of developing cancer. 1 page of each parent's instruction book gets passed on to their children. Every time my grandmother had a baby, 1 page of her book was passed on. Sometimes the page with the change was passed to her child, as shown in this picture. Sometimes the page without the change was passed to her child, as shown in this picture. There is a 50-50 chance that Grandma Wanda will pass either page of the instruction book to each of her children. After the genetic counselor looked at our family tree, she explained how the cancer was being passed down in our family. The counselor suspected that my mother Dolores, Aunt Gina, and Uncle Darnell probably inherited a genetic change or mutation. Since Aunt Alicia has not had cancer, the genetic counselor couldn't tell us whether she had inherited the mutation. The genetic counselor said that Dolores and Gina may have inherited the mutation because they both had cancer at a young age. But the only way to find out for certain was through a special blood test called a genetic test. The genetic test confirmed that both Dolores and Gina had inherited the mutation. The genetic counselor also suspected that Uncle Darnell carried the mutation since his daughter Sabrina had cancer. My sister Imani and I were confused about how our cousin Sabrina inherited the mutation since her father Darnell had not had cancer. My counselor explained that not everyone with the mutation develops cancer. Many men with the mutation, like Darnell, do not develop cancer, although they still have a higher chance of getting cancer, even breast cancer, compared with other men. So even though it looks like the mutation may have skipped Darnell because he did not get cancer, my counselor explained that the mutation cannot skip generations. Darnell inherited the mutation and passed it down to his daughter Sabrina, who developed cancer. So my mother Dolores, Uncle Darnell, and Aunt Gina got the page with the change or mutation. And through genetic testing, we learned that Aunt Alicia got the page without the change or mutation. So now we know my mother Dolores, Uncle Darnell, and Aunt Gina have the mutation in their bodies. The next question that we asked was which of their children inherited it. Uncle Darnell passed the page with the change or mutation to his daughter Sabrina. We don't know if he passed it on to his other daughter. And the same is true for Aunt Gina. Her children might have received the page with the change or mutation, but her children are too young to be tested. This is because people with the mutation develop cancer later in life, as adults. Alicia's situation is different. She does not have the mutation. We can say for sure that Alicia did not pass on the mutation to her children because it is not in her body. This means that Alicia's chance of getting cancer is the same as that of women in the general population. The next question for me was, do I have this mutation? And what about my sister? If my sister or I have the mutation, our chance of getting breast or ovarian cancer is higher compared with other women. So we decided to have the genetic test to find out whether we have inherited the mutation. A sample of our blood was taken and sent to a special lab which looks for these mutations. The genetic counselor told us it would take about 2 weeks to get the results. After 2 weeks, my sister and I returned to see my genetic counselor for the result appointment. The genetic counselor told us that my sister's test had come back positive, meaning that she had inherited the mutation seen in our family. My genetic test came back negative, meaning that I did not inherit this mutation. And this is what we learned about our risk for developing cancer. Because I did not inherit the family mutation, my risk of developing cancer is the same as the general population. In the general population, out of 100 women, 10, colored in yellow, will get breast cancer sometime in their lives, often after age 50. So, Aunt Alicia and I have the same chance of getting breast cancer as these women in the general population. In the general population, out of 100 women who did not inherit the mutation, hardly any will get ovarian cancer, just 2 women colored in purple. So Aunt Alicia and I have the same chance of getting ovarian cancer as these women in the general population. Since my sister Imani has the mutation, her risk of developing breast and ovarian cancer is higher. Among 100 women who have inherited the mutation like my sister Imani, as many as 80, colored in yellow, will get breast cancer in their lifetime. And out of a group of 100 women who have inherited the mutation, up to 30, colored in purple, will get ovarian cancer. Although I was relieved to hear that I did not inherit this mutation, I was still worried about my sister. The genetic counselor told us that there are things my sister can do to reduce her risk of developing cancer. This is what the counselor told us. My sister Imani and other women in my family who have inherited the mutation need to have mammograms and breast MRIs every year, starting in their 20s or 30s. They also need to have their breasts examined by a doctor twice a year and to be aware of their own breast health. There are also some medicines that may reduce a woman's chance of getting cancer. Another way women at increased risk may reduce their chance of getting cancer is by having risk-reducing surgeries. My sister Imani will think about having her ovaries removed once she is done having children. This will lower her risk of developing ovarian cancer as well as breast cancer. Because I did not inherit the mutation, my risk is the same as the general population. Just like other women who have not inherited the genetic mutation, I still need to get regular breast cancer screening. This includes mammograms yearly after age 40, yearly breast exams by a medical provider, as well as being aware of my own breast health. I also wondered about my friend Anna and her family. Anna was worried about her risk of developing cancer. She decided to also see a genetic counselor. The genetic counselor learned that Anna's mom and grandma were older when they got breast cancer, and they were on different sides of the family. Also, there were a lot of people in Anna's family who had not had cancer. The genetic counselor explained that Anna might have a higher risk of getting breast cancer compared to the general population, since 2 of her family members had breast cancer. But she didn't have hereditary breast cancer in her family. The genetic counselor did not recommend genetic testing for Anna's family. However, she was able to provide personal screening recommendations for Anna and her family. We also learned that all women can reduce their breast cancer risk through a healthy lifestyle. Some things known to reduce the chance of developing breast cancer include limiting alcohol use, maintaining a healthy weight, exercising regularly, and eating a healthy diet. These changes will help you live a healthier life.
Thank you for taking the time to listen to Natasha's story. We recommend that you talk to your health provider about your own family history.